So today we're going to be talking about the role that primary care plays in fighting the coronavirus. And everybody thinks of the hospitals, but primary care, you guys play a pretty big role too. So we're going to start off. Can you just kind of tell me, what role do you guys play?
So we're trying to keep everybody out of the emergency room as best as possible because they're being inundated, of course, with people who are panicking with certain symptoms. And we're trying to educate our patients with a triad of symptoms, which is really fever, fatigue, shortness of breath. We recommend patients only go to the emergency room if they have respiratory distress. So it's not just shortness of breath. You have to really have labored breathing, uncontrolled fevers, and mental status changes. So we're trying, again, to just educate the public to try and keep them out of the emergency rooms as best as we can. We are still seeing patients here. We're triaging phone calls. We've been extremely busy at this time, it's a scary world for everyone, and we're trying to keep everybody less panicked as best as we can.
And you mentioned Triad. So what exactly is that? And I know you mentioned the 3 symptoms. And
correct.
When should someone start thinking about those?
So it really is a fever above 102 that is hard to control. And again, like I said, labored breathing, really experiencing shortness of breath. Chest pressure usually is accompanied by that, and a dry cough. So not necessarily, your regular everyday cold with a runny nose and a mild cough, itchy throat kind of thing. And we are seeing a lot of people with allergies too. So people are panicking, are these allergy symptoms or do I have the coronavirus? So again, we're trying to just keep people calm, trying to educate them on what the symptoms really are. If we feel that they are they're a high susceptible person that may have these symptoms, we're encouraging you stay home. Please stay home. Do not go out in public. And we do have limited tests here that we are providing, but we are only doing them in people that we are highly suspicious may have it.
Gotcha. And so the triad symptoms, are those things you should take into account before you make the call to your primary care?
I mean, again, we're educating. We don't mind the phone calls at all. But yeah, those are the things that you want to think of. And I don't want to skew people away from or discourage them from calling us. We're always available to answer questions, and we've been, again, trying to just educate people when they do call. If they do feel better coming into the office to be checked out, we're more than happy to see them.
Gotcha. And I know we were talking before about the shortness of breath and respiratory distress. I know we were talking that they seem similar, but they're 2 different terms. Can you kind of explain the difference between the 2?
So I have had a lot of patients coming in saying that they have shortness of breath, but when they're sitting on my exam table and I'm able to have a conversation with them without actually seeing them gasping for air and having difficulty breathing, that's not shortness of breath. Shortness of breath is really, like I said, respiratory distress, just sitting at rest and having a hard time breathing. It's not climbing a flight of stairs and being a little bit short of breath. Very different. You're sitting at rest, you're having a hard time taking any deep breaths because it hurts.
Right, and I guess, like you said, you guys have been receiving a lot of calls, talking to a lot of different patients. And what are some precautions you guys are taking here in, the primary care and, exam rooms too?
Yeah, so we've been cleaning the rooms as best as we can, each patient that leaves. When the patient comes to the door, our doors are locked. We're asking, and we have signs on the door, we're asking patients to call our phone number when they get here so that we can check them in. When we have a room available, we have a staff member go out and get them. If they're coming in for a sick visit, we are providing a mask before they enter the building, and we bring them into the room so that there's no exposure with any other patients. We do not have anybody in the waiting rooms waiting with each other. We ourselves are also limited in the number of masks that we have, glove supplies. So we're being very careful with our patients, and we are wearing N95 masks if that patient is coming in for a sick visit. especially if they're coming in with those triad of symptoms. Those are the precautions that we're taking.
Yeah, and I guess when should someone, or how do you tell the difference between seeing a primary care, someone at your primary care office, or going to the emergency room? I guess, is there a difference, or different cases warrant different locations, or?
Yeah, so again, if you feel that you need to go to the emergency room, it should be for those symptoms of a high fever over 102, mental status changes, as well as that labored breathing that we were talking about, that respiratory distress. The emergency rooms right now, again, are being inundated. So they're trying to keep people away by you've seen the media. They're trying to say, do not come to the emergency room unless you absolutely have to. When you come to your primary care, we are able to delineate and manage who should stay home, who can we treat outpatient, and who really does need to go to the emergency room. So again, we're able to triage for the emergency rooms as a primary care.
And staying on the topic of primary care and emergency rooms, I know, like on TV and the media, you hear a lot of how bombarded the hospitals are. Is that the same for primary care as well? Or,
Yeah.
What have you guys been seeing?
We've been converting a lot of our patients to telehealth visits. If they feel comfortable in doing that, and we've been doing that over the phone, we've been doing that over FaceTime, we've been doing that over our electronic medical records systems. So we've been extremely busy between the telehealth visits as well as patients coming into the office. So we know our patients, and that's one of the nice things about being able to still see our patients. We know you, we have your medical records, we know what medications that you're on. If you go to the emergency room, they don't know you. They may have your medical records, but again, you want to save that for emergency cases only.
Gotcha. And I guess, kind of lost my train of thought here, but I guess what would you say has been the most common symptom people have been coming you to see for?
So sick visits, especially, we've been seeing a lot of people with allergies. We've been seeing a lot of asthma exacerbations. So of course, if you have asthma, you are at higher risk for getting the COVID-19 coronavirus. And people panic because they're not sure, are these symptoms of the coronavirus, or is this my asthma exacerbation? So we've been seeing a lot of asthma, we've been seeing a lot of allergies, we've been seeing some strep throats here and there. Those are probably like the big ones. And again, just providing reassurance most times.
And what are like some of the more common questions that you've maybe got on the phone or when people coming here in person?
Yeah, so the most common questions that I've heard is, I've been having this, a little bit of a sore throat. I've been having some dry cough. I feel like I'm short of breath when I'm climbing the stairs or doing a lot of housework. So again, you have to triage that. You have to ask the appropriate questions. Do you have a fever? Is the breathing labored? Are you having chest discomfort with it? Those are the big things. If there's no fever, chances are, again, they say that some people may be asymptomatic who have the coronavirus, but more often than not, they're not experiencing those symptoms.
And I guess last thing, what's like the main message you want to tell the public in terms of, the way they use their primary care in trying to fight this virus, or, especially during this time?
Yeah. So I just want to put a message out there that, your primary care physician is here for you. Our office is open. Don't hesitate to call. We're here to help answer any questions that you may have. And if you feel better coming in, we're happy to do that. So again, the biggest message is, let's keep the emergency rooms available for those that really need it, and we'll help to triage and be on the outskirts trying to keep the chaos away.
I guess, is there anything I didn't ask you? I know we covered a lot, but is there anything that comes to mind that you still would like to mention?
I don't think so. I think we covered everything. just be nice to your primary cares. And I know everybody's in panic mode right now, and our phones are often very busy and people are having a hard time getting through, and I understand the frustration behind that, but do know that we are doing our best. We're working with limited staff. We're down to a skeleton crew because of safety reasons as well. So we're trying to keep ourselves healthy as well as the rest of the public. So patience is a virtue right now.
Gotcha. All right. Jessica, thank you very much.
Thank you.
All right. Well, if you missed some of our interview, you'll be able to hear more from Jessica, the full interview, on 22 News tonight, starting at 5.